Hello, dear friends. Welcome to another session of Doctor's Diary. I am Dr. Ritu Sethi, Senior Consultant, Obstetrician and Gynecologist, Cloud9, Sector 14, Gurgaon. Dear friends, today I am here to speak about a very important topic, which I'm sure many of you are really not aware about. This topic is when you are supposed to visit a gynecologist. First of all, let me explain to you that a visit to a gynecologist is of utmost importance, whether you are having any problems or not. It is both a preventive as well as a treatment type of a consultation. Many women I have seen are actually very scared about visiting a gynecologist because they are not really sure as to what all problems they can bring forth before their gynecologist, what whether they should be visiting their gynecologist with simple problems or not. And but let me first of all assure you, if you visit your gynecologist on time, the solution to most of your problems can be dealt with before the problem grows out of proportion and it becomes unmanageable. So, what are the simple complications or the simple problems for which a visit to a gynecologist is a must? First of all, most women should be going visiting a gynecologist for things as simple as a breast examination. Yes, very important. Visit your gynecologist for a complete breast examination. Your gynecologist will teach you how to do a complete self examination in the shower, which should be done every 2 weeks in every lady. Also, once a gynecologist examines you, she will be detecting any kind of lumps, any change in the density of the breast. She will also be examining the axilla or the underarm to see whether any extension of the breast is abnormally extended or not. So, you should also be bringing to your notice to your gynecologist any kind of nipple discharge. If you feel any kind of bloody discharge, if you feel any kind of milky discharge in the breast, and she would be guiding you about the same. This is again very important because of the rising incidence of breast cancer these days. So, breast cancer by a simple breast self examination or a simple examination by a gynecologist can be treated well in time before the problem grows to a large extent and becomes untreatable. So, first of all, important is going to your gynecologist for a breast checkup. Number one. Number two, when again should you be visiting your gynecologist? Simple things like pain in the abdomen, pain in the pelvis, especially. Some women I have seen keep complaining of pain lower down. They feel that they are not comfortable and they feel that there is some pressure down there. They feel that once they are peeing, once they're going to the washroom, they don't feel very fresh and they feel as if something is just coming out. This can be a symptom of a pelvic inflammatory disease. So, again, if detected in time, pelvic inflammatory disease can be dealt with because before it becomes so severe that it leads to blocked tubes or even infertility. So, any kind of pain in the pelvis not being treated by simple antibiotics, which of course your gynecologist would be prescribing for you, you should bring to your notice. Some women also complain of problems like something coming out of the vagina, or whenever they sit in a position, whenever they squat, they feel that a part of their body is coming out. These are symptoms of a prolapse. And if a prolapse is detected in time, it will not progress further. But in case it progresses to an extent that the entire uterus is coming out, then even surgery might be required. So, early treatment of prolapse can happen by simple exercises, which your gynecologist would be telling you about. So, again, be very, very aware of these problems. In case you have any, please bring them to your notice of your doctor. The third problem, any kind of checkups, like for example, if any lady has any kind of menstrual complaints, irregular bleeding, bleeding in between menses. As I'm sure all of you are very well aware, the menstrual cycle usually lasts between 21 to 35 days. The bleeding usually lasts for 3 to 4 days, and maximum napkins which a woman has to change between her during her menses is probably not more than 3 to 4. In case you feel that there is some change in your menstrual cycle, you are bleeding more frequently than you were earlier, you are spotting in between your menses, Your periods are so heavy that you are changing pads every 3 to 4 hours. You are passing a lot of clots. There is severe pain during your menses, which was probably not present earlier, which is present to an extent that I have some women coming to me and telling me that they have a fainting sensation. The menses are so painful and they are so heavy. These can be symptoms of some kind of a growth on the uterus, which is probably a fibroid uterus or something which is called cyst on the ovaries, also called endometriosis or chocolate cyst. These are all symptoms of these kind of problems. And before the problem gets out of hand, please go and pay a visit to your doctor in time. Another reason for which you should be visiting your doctor is in case you're having very infrequent menstruation. As we are all very well aware of, PCOS is an epidemic amongst young women of reproductive age group these days. So, in case you are having early symptoms of PCOD, pay a visit to your doctor so that she can detect the symptoms and she can kind of suggest certain preventive remedies for you. Diet and lifestyle goes a long way in treating these symptoms of PCOD. Before these things get out of hand, you may even end up with infertility or you may even end up with a lot of skin problems. Sometimes the problem might become so severe that you end up taking medications for diabetes, or your doctor may even have to put you on the oral contraceptive pill. So, in case your menses are too irregular and you feel that you have put on weight suddenly, then very important to point out the symptoms immediately to your doctor. Again, in pregnancy, PCOD usually hampers the patient in a way that it can even lead to gestational diabetes during your pregnancy. So, friends, please do watch out for these symptoms. In case you have any, bring them to the notice of your doctor. Why I'm saying this is again and again is because PCOD can lead to infertility and it can lead to other problems in case you're planning to conceive or once you become pregnant. So important is to visit your gynecologist and treat these problems in time. The next problem for which you should be visiting your gynecologist is for a preventive checkup, especially for gynae cancers, the most important being cancer of the mouth of the uterus, which is a cervix. Cervical cancer, as I'm sure all of you are very well aware, is a totally preventable condition. The time from which cervical cancer progresses from an early stage to full blown cancer or late stages is approximately 10 to 15 years. A simple test done on the gynecologist's couch, which is called a Pap smear, goes a long way in detecting this problem. A Pap smear is recommended for all women who are sexually active. Cervical cancer vaccine is given to them accordingly, and it is done every 3 to 5 years of age, depending upon your age. And in case your doctor feels that the cervical smear, which she has done for you, has not turned out to be normal, she is going to go ahead and tell you how soon you have to come back for a follow up so that your treatment, the cure for this early precancerous stage is can be done totally before it becomes a full blown cancer. Usually, cervical cancer is the most common cancer in India in women, gynae cancer in India in women. And once it is detected, mostly it is too late because women are not really aware of the symptoms of this problem and they are not really aware of the preventive tests which are to be done to prevent this cancer. Now, the most important, I would be coming to the last most important problem for which you should be visiting your gynecologist. Any kind of itching in the vagina, any kind of abnormal discharge down there, if you feel that you are having a discharge which has turned green or yellowish in color, which is foul smelling, maybe it is a curdy white discharge which was not present earlier, please do go and visit your doctor. This may be a symptom of a fungal infection, and fungal infection is totally treatable before, and it can also be a sign of early diabetes. So, a proper gynecological checkup will detect other symptoms which may be hidden in your body. And once a fungal infection is detected, it can be treated in time before it becomes full blown. Also, itching in the vagina or in the outer area is usually a problem which I have seen most women come to me. I tell them if you're keeping good hygiene, washing your area with soap and water every day, keeping it dry, you don't need to worry because discharge in every woman is normal. But in case the itching is so tractable that it is disturbing your day to day life, or it is causing a lot of symptoms like redness of the skin, or cutting on the skin, or or cut marks on the skin, yes, again, you might be suffering from a fungal infection. So, friends, today I have outlined to you all when you should be visiting your gynecologist. Now, what is the right age to visit a gynecologist? This is another question which usually comes to the mind of most of my patients. According to the American College of Obstetrician and Gynecologists, a gynae visit is recommended for all women, all girls from the age of 13 to 15 years of age, starting from the age of 13 to 15 years of age, after which they are also given a cervical cancer vaccine. But in the Indian scenario, usually I would recommend all women to come for a gynae checkup at least every year, every 2 years after the age of 18 years. In case they are sexually active, uh, or they are married, they should be coming for routine pap smear. They should be coming for their routine uh, checkups to see to detect any symptoms of breast or ovarian cancer in case they have a family history of either, because both breast and ovarian cancer are cancers which are hereditary. So please do not delay your problems. Visit your doctor at the earliest and do going for routine checkups. I hope you liked my session. In case you have any queries, you are more than free to ask me anything. Right. Okay. Yeah, thank you, Angel, for giving me a patient hearing. I hope I have solved most of your doubts and your queries today. In case you are kind of, having any other questions, please do like and subscribe uh, my Facebook page, and you can go ahead and ask me a number of questions which are coming to your mind anytime. Yeah, I would be doing the next session on after delivery care, definitely in my next session. And I just wanted to pick up a topic which other people had been telling me about. But yes, my next topic would definitely be on after delivery care, Angel. Sure. Okay, Shubham, I would be doing another session on prenatal care too. First of all, I would be doing a session on after delivery care in my next talk. The next session we would take on prenatal care definitely. Thank you for joining me for this session. Do feel free to ask me as many questions as you want. Thank you and have a good day.